Hey guys, welcome back to Critical Care Connection. This is Larry. So I'm excited. Today's part 2 of our IV video. This is going to be geared towards difficult sticks, tips and tricks on how to be better with IVs, and then we're going to also talk about some things that may hamper your ability to stick. So we're going to cover a lot of different things today, and we're going to make it fun and interesting. I've taken a couple hits from my wife. She's been practicing just so you guys can help learn and grow a little bit. So let's get into it and figure out about difficult IVs. So when we talk about IVs, what are some of the major things that people come across that make IVs hard? What are some of the difficulties? Not everybody comes in with prestigious veins, or even some of the people that do. Maybe they're there and now all of a sudden they're not so great anymore. Why is that? So here we go. Let's take a look at my left hand. So this is normal. This is me just coming down, sitting down, doing some work, nothing special. But this is what you would have to work with. Now let's move it around and say we put the tourniquet and a hot blanket over the whole arm. And now after about 10 minutes with the blanket, a minute and a half now with a tourniquet, look at the difference in what's available there. Wendy's rubbing some alcohol on. Sometimes this helps with the visibility. So you've got hand veins, you've got one over the wrist, you've got, it's hard to see, but you've got a basilic and a cephalic vein when the arm's turned over. You have got a ton of options there now. And the video doesn't do it any justice, but this made a dramatic improvement in what was there for visibility wise. So these are the things that you can do for your patients, and look how much difference that could make. And what is that difference going to make as far as your success? It's huge. All right, first thing up on the docket is going to be IV catheters that are valved versus non-valved. This is something that a lot of people asked about last time. So people that aren't familiar with the two differences, basically in a valved catheter, once you stick in the vein, you'll get the flashback, but it will only come so far. It won't continuously leak out. There's a valve there to stop the blood from flowing out. So older style catheter used to not have a valve. So you had to be a little bit more thoughtful in your hand placement as you're sticking. So when you stick with a non-valved, you're going to have to occlude that vessel above where you stuck at, or you're going to make a pretty big old mess. So let's take a quick look at a video of a valved catheter first that's being stuck versus a non-valved catheter on the second one, and just look at the placement and how the control of the flow is on both of them. All right, so on our example here, you can see Wendy's looking along the arm. She's trying to decide on a site, and it looks like she's going to go mid forearm on this one. So first catheter is a valved catheter. So what she's going to do, she's going to hold the skin taut there. That way when she sticks, the skin's not going to wrinkle up. You see there she got an immediate flash, and she's going to forward the catheter in, and there you have it. The chamber fills, but look, when she pulls the needle out, nothing happens there. So here is the non-valved. We're just going to go right above it, make it simple. As she sticks, look for a flash as she gets it right behind her finger there, and she's going to advance it. Now look what she's going to do with her other hand. She needs to hold pressure on that catheter and above, and as she holds pressure, it occludes and does not bleed. But if she takes the pressure off, then it's going to bleed out some, and you're going to have a mess on your hands. So just want to show you the difference in the two because it was asked about before. All right, I brought this back up from our initial IV slide. The best place to stick it. Yes, this is super important. You got to remember, these are anatomically where your veins are going to lay. And if you look at the overlay of the diagram versus the actual person's arm, yes, I know it's exaggerated and those veins are huge, but look at how they lay out in comparison to the diagram. it's almost an exact match of what you see on one from the other. So remember how important it is when we're talking about knowing where the vessels are to stick initially, because that's going to help you a lot in the long run. So study up. Remember basilic versus cephalic and what side they're on and how they kind of run down the arm, because everybody's arm is going to have this. Yes, it's going to vary a little bit from time to time and person to person, but anatomically they're going to be there. So you're going to know what to look for, and it's going to give you kind of a scope on where to start at. All right, so tip number 1, position your patient's arms or limb so that it's hanging lower than their heart. So if the patient's laying in the bed, if they're laying flat, a good start would be to raise the bed up a little bit if they can. If not, drop the side rail and let their arm hang down. This is going to allow the blood flow to go lower than the heart, and we know that anything that runs downhill runs better. So this is going to give you an advantage to having that limb that you're sticking fill with blood faster and easier. Number 2, placing a warm blanket or warm compress over the area that you're going to stick. This is going to help bring the veins to the surface of the skin. A lot of the people that are in the hospital or they're in the doctor's office at that time or wherever they're at, a lot of times they're not the warmest places. And sometimes just putting a warm compress or a warm blanket over top of that area will help bring those vessels to the skin. When the body's cold like that, it's really good at bringing stuff inside, because what's inside? Core temperature. Core is warmer. So it brings those in to help warm the blood. So if we put something warm over top, that's going to help bring and release everything back to the top, making things easier for you to see. Interesting tidbit. Amongst being cold, what's one of the other factors that make people's veins just disappear? Fear. Most of these people are in the hospital. They're scared. They don't want to be stuck. Needles are terrifying. So why does fear make your veins go away? Does anybody know? Well, it's a sympathetic nervous response that everybody has. And a lot of people know of fight or flight. Well, that's essentially what's going on here. Because when you have this fear, your veins are going to vasoconstrict, so they're going to get smaller. But what is the body, what's it doing? Like, why does this process take place? So when they vasoconstrict, their goal is to pump more blood to the brain and skeletal muscles, because we're going to do what? We're going to fight or we're going to flight. So we're prepping our bodies to do one of those two. Our brain's heightened, skeletal muscle is heightened. We're ready to do something. We're ready to have some kind of action. So now the body says, well, the skin doesn't really need as much blood flow as those things because they're getting ready to do something. So a lot of times you look at somebody that's completely scared, well, they're pasty white and pale. Well, why is that? Blood has been shunted away from the skin to service the brain and skeletal muscle. So that was a cool fact. Thought you might like that. Number 3. So go ahead, before you get ready to stick at that moment, go ahead and place your tourniquet on the patient while you're getting things ready. I think one thing that we do, and we don't do great sometimes, is we put it on right before we get ready and we don't give it enough time to work. So place that tourniquet on a minute or 2 before you get ready to stick. Be patient with it. Give those vessels time to engorge with the blood. It's going to take time. Remember, we're still allowing the arterial flow in because it has more pressure, but the job of the tourniquet is to stop the flow coming back, which is not quite as strong. So that's why we put the tourniquet on nice and tight, and it's supposed to stop that flow back. So allow it some time to work. Don't be in such a rush. Give it a minute or 2. Number 4, add a second tourniquet a couple inches above the one if you're not getting your desired results. When one tourniquet stops some of the flow, if we add a second one to it above it, this will help slow the flow even more. And that effect is going to compound down low, and hopefully we're going to see a rise in some of those vessels to help you stick. All right, number 5, have the patient squeeze their hands up and down or give them a stagnant hold. This is going to work those muscles down in the arm, and that's going to help pump blood to that extremity. And what's going to happen when we pump blood to that extremity? Well, it's going to push more blood there. So let's give them some time to do some squeezes and see if this helps pop the vessels up a little bit more. Number 6. So one of the tricks you can do once you put your tourniquet on and you start to look and you find something you like, take the cap from your IV start kit, place it on the skin, and then after that, just kind of hold it there, put a little pressure on it, and this is going to make an indentation to where it is. And what that's going to do is if you need to step away or you need to look at something else, when you go back to start this IV, you're going to have this nice little circle right above your sight, just like a bullseye. This is going to help you relocate. I think we all know sometimes we go back to stick and we don't see anything, just like it was right there the first time and now it's completely gone and you can't find it. This is going to give you a bullseye to put you right back on sight. Number 7, if you have really superficial veins, remember, change your angle of your IV. This is super important because these superficial veins, it is so easy to go right through them and then you've blown it. So remember, lower your angle if they're on the top of the skin, go low and stay slow. Number 8. So if the situation is appropriate, sometimes tapping the veins will create an inflammatory response at that site. And what happens when that tapping occurs, it will sometimes pop those vessels up for you and allow you to see them a little bit better. Now, does this work for everybody? No. Is it appropriate for everybody? No. But it is a cool trick of the trade that I was shown a long time ago, and it does work, and I'm going to show you a little clip of the tapping and the immediate response that follows. So you see, as she's tapping the back of the hand, the veins were already pretty visible, but it's making them more pronounced. If you were to go back over this, you would see a difference. Now, when we do the upper arm, I think you're going to see a bigger difference. So look at the upper arm. Pretty flat right now, right? Now, as she continues to tap, look at this upper arm here. You can almost, with your eyes now, you can almost see those veins becoming 3D. They're popping out of the skin right there, and they're becoming way more visible to access. Number 9, make sure you look over the entire arm or extremity before you decide. There's nothing there to stick. Sometimes a simple twisting of the hand or the arm can reveal a lot more than what you saw the first time. So make sure when you're sitting there looking at it, twist the arm around back and forth, and even pull that arm up and look on the back side of the arm. There are really big vessels that run on the underside of the arm. Yes, I understand it creates a little bit of an acrobatic IV stick for you, but if you can position yourself right, it creates a whole new structure of things for you to see. So just remember, look at everything before you say, I can't do it. Number 10. So remember your hand placement when you're sticking. Remember to always anchor the skin, and if you can, anchor the vessel underneath. That way they're both taut and they're not going to move around. This is going to be huge on people that have rolling veins because, you know, if you don't anchor anything down, the needle as it goes in, it's just going to push the vessel to the side. So you want to make sure to hold above, and then with your sticking hand, I always kind of settle it in, and then it gives me a tight surface as I'm getting ready to stick underneath. Prime example. Nobody really looks much at the back of the arm. Look at that whopper sitting on the back there. If you never turn the arm over and you never look there, you would miss that. It's something that's always most of the time there. It's an awkward angle and you got to be careful. Remember which direction you're actually sticking your catheter in. You don't want to stick it in backwards because now you're going to have to poke from the top side down. But it's there. All right. Now, if you're going to stick IVs, you're going to miss IVs. That's the lay of the land. That's the way it works. So here's a little clip of one of the sticks that we did, and you can see from the different angles, you can see why we missed it. So when we came in, we were to the side, and just be watching for that in the video and you'll see what I'm talking about. And then as we try to manipulate it, then we ended up blowing it, and you can see the importance of that because you'll see that puffy area right at the stick site. So although I want the video to be perfect and all the things go right, I think it's important for you to be able to see what happens if you miss too, and kind of the things of why and what to look for afterwards. So obvious right there on the side of the arm, you're going to see the vessel that she's going to stick. Now, when you're going to stick IVs, things are going to get hairy for you. It's not always I see it, I stick it. Sometimes when you stick it, you're not where you think you are. So you can see as she inserts this, we weren't holding tight at the bottom. So the skin slid up, and now you can see the IV catheter is beside of the vessel. And she's trying to kind of take a different approach and maybe come in from the side. But the more that we mess around, obviously, as in the TikTok, the more you F around, the more you're going to find out. Well, the more we poke around, the more chances you are to blow that vein. So as she's trying, sometimes you can get lucky and you can come back in and you can strike gold. But a lot of the times this is going to result in a vessel that blows. And you're going to see as she keeps trying here, there's a little flash, but this is from where the vessel has blown. So she's going to try it just to see, but as luck would have it, that area you can see it's whelping up now. So that's the blood leaking out of the vessel into the surrounding tissue. It's blown. This is a good learning for everybody. All right, guys, thanks so much for coming back out. I really have been wanting to do this video for a while, and we've just been doing other things, so I'm glad we finally got to it. I really hope this helps you guys with your IV skills. Most certainly, if you have questions, ask me, leave a comment. I'll get back with you as soon as possible, and if there's something else you guys want to see, just let me know. Otherwise, strong work. We'll see you next time. Hold up. Wait a minute. I almost forgot. I got to thank the most special person. I got to thank Wendy, my wife. She's the one that stuck me. She's a masterful IV starter. Thank you so much for stabbing me with a needle.